So the NCLEX is the NCLEX is what we call a CAT exam. You may have heard that term before. A CAT is computerized automated testing. And so what that means is it's actually got some artificial intelligence algorithms built into the exam. So when you take the exam, the questions are all graded in levels of difficulty. And so we could make a little chart, and we could say that the most difficult question is a 5, 4, 3, 2, 1. And question difficulty has fancy terms which are based on what's called Bloom's taxonomy. Bloom's taxonomy is what guides educators for writing test questions. And so the most difficult is called the application level. I gotta throw these dry erase markers that don't work away. So the application level question will be the most difficult, and that's a question number 5, or level 5, and so it's asking you usually to apply your knowledge in some way to a real patient. So it's going to give you a patient scenario, and then you have to pull from usually a couple different areas like pathophysiology plus therapeutic communication, pull all these together to answer the question. What would you do for the patient? What would your number one priority? A lot of times the question will be, what would you do first? So they would have that one little word in there, totally throws you off. A well-written NCLEX question is usually 4 choices. They're using alternate formats, but like select all that apply and those kind of things. But in general, the average NCLEX question is going to be multiple choice with 4 correct answers. That's a well-written test question at the application level. You will have 4 correct answers, and your job is to figure out what's the most correct answer. The most correct answer. At the very bottom, we have what we would call knowledge level questions. That's the very bottom of Bloom's taxonomy. And so if you get a question that is just cut and dry, black and white, what is the normal range for CO2 on arterial blood gases? That would be a knowledge level question. You either know it or you don't, and it's just sheer memorization. An application level question would have you actually interpret the ABGs and then ask what your very next step is going to be for that patient. His CO2 is 105. What's your very next step? Does that make sense? The difference between knowledge and application. So then, the way the NCLEX works, because it's artificial intelligence, is essentially you have to score, on average, above a level 3 on your test taking question. So what that looks like is the very first question that you get is usually a level 3 question, which means it's just right at the passing mark. Just could go either way at this point. If you get that question wrong, the very next question will be a level 2. If you get that question right, it's going to bump you back up to a level 3.
What if you get the first 3 wrong?
If you get the first 3 wrong, you're here and then here, and now your third question is a knowledge level question. So what that means is you're now in a hole as far as the artificial intelligence algorithm is concerned. You've got to get this one correct so that you can get the next one correct, so that now you're just barely passing, testing at a passing level. In an ideal situation, you would get this one right, the second one right, and then that's going to give you an extremely difficult question at the application level. If you miss that one, you're going to bump down to level 4. If you get that one correct, you'll bump back up to a level 5. So by the time you're done taking the NCLEX, if you're passing, you should be missing every other question. So the last half of the NCLEX, you should be averaging about 50%. So if you walk out of the NCLEX and you feel like you just completely bombed it, man, I completely bombed that. I only knew every other question. That's a good feeling. That's good. Because that means you're testing at an extremely high level. If you walk out of the NCLEX and think, man, that was a PUD test. I aced that thing. It could be that your last 10 questions were at the knowledge level. Does that make sense? That's how the NCLEX works.